chain drug review, and mass market retailers video forum. Brought to you by the Emerson Group.
Hello everyone, I'm Jeffrey Wolt, Editor-in-Chief of Retail Media IQ. Welcome to our video forum. Today we're thrilled to have as our guest Nancy Lyons, Vice President and Chief Pharmacy Officer at Health Mart. Nancy, always good to see you.
You as well, Jeff. Thanks for inviting me.
There are about 4,000 independently owned pharmacies in the Health Mart network. How does the support that Health Mart and its parent company McKesson provide help these members deal with the financial and operational pressures that are affecting pharmacy operators of all sizes?
Yeah, it's the reason me, my team, and multiple people across McKesson exist. And I think just to call out, you hit on the most important part of that sentence, that they're independent for a reason, and they own their brands. They also need help to be able to do some of the back office opportunities, some of the access to scale opportunities that Health Mart and McKesson can bring them. And we just work on empowering them every day, supporting the things that they need to do to manage the teams, the processes, the products that they need, and then to be able to deliver that care that they're so focused on. You know, it's been described, it's not just a patient. They really believe that those people in the community are their patients, their neighbors, their friends, and they want to keep them as healthy as possible. So any resources that we can give them to give them more time to do that is what we focus on. That personalized patient care doesn't come easily. They need the tools to be able to check that their employees are meeting OIG requirements all the way up to the patient care. And then even making sure that they're maximizing the dollars with solutions they can also enroll in, things like provider pay, McKesson Reimbursement Advantage. And even our RX ownership team comes into play often, helping them understand the financials and really building for that future.
There's been a lot of policy activity at both the federal and state levels, and I know Health Mart and McKesson are very involved in that. What are the key priorities for your membership at this point?
Yeah, it's really aligned with McKesson's overall policy priorities, which are anything that we need to do to make sure that the patient comes first, the patient's at the center of everything that we believe in, and our members are definitely there too. And from the pharmacy perspective, it's really working with those legislators, with those policymakers to make sure that they understand the important role that community pharmacies play. 60% of Health Mart locations are in rural and underserved areas across the country. That they need to have the sustainability pieces to keep those their general operations open, and then the tremendous opportunity that is there for the healthcare system in general to make sure that pharmacists are given the opportunity to work at the top of their licenses. Technicians are doing all of the things that they're trained to do, and really focusing on those state pharmacy associations that are advancing standard of practice, standard of care models for pharmacists, anything that we can do with advocacy that brings the care closer to the patient by those providers that are so well positioned to do that.
You mentioned the states and the state associations. I know McKesson has a program called McKesson Amplify, which is designed to support their work. Maybe you could talk about what you hope to achieve through McKesson Amplify.
It's one of my favorite topics to talk about, just because the impact that it has had and has the potential to continue to build into the future. So McKesson Amplify is state pharmacy associations funding project. A couple of years ago, the company was really trying to make an impact in the advocacy that we do, and realizing that most of the progress is happening more quickly at the states and more meaningfully at the states. So funding was aligned, an application process was set up, and state pharmacy associations were told to tell us your goals, tell us the things that you want to work on, and McKesson will align funding. But McKesson is so much more than the funding that is provided to these state associations to empower pharmacist-provided care. It's been called a movement where some of the state associations that had barriers, many of them work on volunteer basis in many states and really just need that budget stability to do the things that they know that their communities need. Our first funding started flowing in 2025 after the application process that was announced in 2024. We're now in year 2 of funds going to the pharmacy associations. We were happy in year 1 that we funded state associations in all 50 states. And in year 2, every association that applied received funding. And we're getting ready to announce that the funding for 2027 applications will be opening in a couple of months. And just seeing the quality of the activity, the achievements that the state pharmacy associations are having. Again, their goals, their directives, but we've removed a barrier for them to getting that good work done that they do every day.
Nancy, let me shift gears slightly and talk about pharmacists themselves and their desire to do more for patients. Can you talk a little bit about how McKesson is helping them take advantage of existing opportunities in terms of test and treat, monitoring chronic patients, and where allowed, prescribing even?
Yeah, definitely the wheelhouse for community pharmacy. When those abilities and authorities line up across the state, and they are growing across the country, where pharmacists can do things like prescribe medications, they can do things like managing chronic conditions, really just making them as well prepared with the knowledge, tools, and resources to do that in today's realm. Community pharmacies are great at the transactions related to safely filling prescriptions. Their systems are built that way. Their workflows are built that way. We are trying to help them understand that patient care services fit within that workflow with some modifications, giving them the advice, the tools, the education to be able to make that happen. And then access through some of our power with our Health Mart Atlas group to bring solutions in for them that they can take advantage of and receive that sustainable payment. So pulling all of those pieces together. And I don't want to forget what McKesson does best with some of the product access. So definitely linking them up to the right testing tools. Last year, we also launched our new vaccine optimization solution for Health Mart pharmacies. This helps pharmacies get good prices for the vaccines that they're going to get into the patient's arms of those communities that they care about so much. And it adds in those tools and resources to make sure that their full team is ready and able to do that safely, effectively, and in the way that those patients need. We've also expanded our Health Mart Perks program, which is a program that offers members the opportunity to get better pricing from vendors for everything from FedEx to different services that they might need in their pharmacy. As the nation is going forward with automation and all of the things with AI, we're bringing in vendors that align with those, so those pharmacies can make the best decisions for their businesses.
Moving away from pharmacy for a moment, how is Health Mart helping your members support the front end business?
We know that they need to extract every bit of value out of the space that they have. So whatever their square footage is, we want to make sure that they're pulling all of that together. We have tools like Pinpoint Community Solutions that help them with their inventory. We also have a private label brand of front end products called Foster and Thrive that are those high quality, hopefully return visit medications, over-the-counter medications that will bring those patients coming back to their pharmacies again and again with that name recognition and that kind of value brand from a store brand perspective, and we're really excited about that.
We're seeing a lot of pharmacies close these days, unfortunately, and that's resulting in pharmacy deserts in a lot of places. McKesson has a program called Project Oasis, which aims to help solve that problem or help alleviate it anyway. Can you tell us a little bit about that?
Yeah, it's another one of those proud to be a member of the McKesson family projects. The team that works on the Project Oasis um, recognize that millions of patients in the U.S. face the barriers to getting essential care. Within just our Health Mart franchise, again, most of the pharmacies, a majority of the pharmacies can be the only healthcare provider in their local neighborhood, just as hospitals continue to close and all of those. So McKesson's improving patient care by powering healthcare locally and solving access and affordability. And I think an added perk is fostering some entrepreneurship. So to expand the access to these essential pharmacy services in under-resourced communities, the company looks for the right pharmacist owner that wants to come in, and then through an accelerated process of independent pharmacy ownership, brings them to the forefront to open these pharmacies.
You were honored this year by both J.D. Power and APHA. Maybe you can tell us about that recognition.
So we have to make sure we're talking about the right you in both of those situations. So J.D. Power was all about those members, those nearly 4,000 independent community pharmacy owners across the country. In 2025, Health Mart pharmacies were ranked number one in the customer satisfaction in the J.D. Power 2025 pharmacy study among chain drugstores. A testament to the work and the relationships they have every single day with their patients. Flipping the script for the other you, the H.A.B. Dunning Award is an award that APHA gives to organizations like McKesson and Health Mart for the work they do supporting community practice. So while I was the lucky one to be handed that award at the annual meeting just a few weeks ago, it's a testament to all the things that our collective teams across McKesson do in supporting that community. The things like Amplify, the things like distribution, the things like supporting them. And extra special was that the current APHA president at the time, Randy McDonough, who's also a Health Mart member, was the one who was able to present that award. So it was just an added kind of cherry on top for the recognition that the company received.
One last thing before I let you go. Coming up in June will be McKesson ideaShare, which is your annual conference and trade show for Health Mart members. What should people expect this year? When it's in Denver, I believe, yes?
It is Denver, so mile high excitement. Every year, our summer conference is just the pinnacle, bringing the Health Mart and other pharmacies and vendors and everyone together for, as the name suggests, idea sharing. That peer-to-peer learning is what we really hinge all of the programming that we do. So you'll see the connection points, you'll see lounges and things on the show floor. We're bringing some keynote speakers that get everybody thinking, but it's really education, so interactive hands-on sessions, expert discussions, and all of that. And then our vendors really partner with us so well each year too on the exhibit floor and really engage with the customers, letting them try on solutions and listen to the needs as they're developing new things. But probably the highlight of the event for me is always the Health Mart Pharmacy of the Year discussion. We have 3 finalists selected. They will be up on stage being voted on by their peers. And it's really an annual award that recognizes, again, peer-to-peer excellence for a pharmacy, for clinical, business excellence, commitment to leading healthy communities and advocating for pharmacy. So I can't wait to see what this year's finalists will bring in their presentations, but super excited for coming up right around the corner in Denver.
It's always a great event. I look forward to it, and I thank you for your time today.
Thank you, Jeff. Have a great day.